The Blue Water Health Critical Care Outreach Team, or CCOT, is made up of the ICU registered nurse, respiratory therapist, and the intensivist. CCOT team membership is over and above their daily assignment each shift as an added support to clinical staff throughout the hospital. The CCOT team listens to everyone's concerns and works alongside the unit staff to provide safe, effective patient care. There's an extra level of comfort for unit staff knowing they have the 24/7 support of the CCOT team. Blue Water Health's early warning scoring system assists healthcare providers in identifying patients at risk of or undergoing deterioration. The CCOT complements this scoring system by supporting patients and staff on the floors. CCOT responders are experienced, specialized staff who, upon assessment, can activate medical directives that will provide timely diagnostics and intervention. The timeliness of intervention improves the ability to treat the patient in the unit or move the patient for the right care at the right time in the right place. Each team member contributed to achieving the team's outcome and continuously looks for ways to improve the team's effectiveness. They work with the unit staff and patients and families to put the patient's needs and wishes at the forefront. The paramedic program team began its work in spring 2017, collaborating with the County of Lambton and the Community Health Links partners on the Sarnia-Lambton Community Paramedic Program. Its goal is to keep frequent users of the emergency department at home with resources, improve access to the emergency department, and improve access to ambulances for Sarnia-Lambton. A large number of ED visits had been from a small group of individuals addressing the same issues consistently and calling 911 to get to the ED. These patients required medical attention, but their care needs could be better managed with community resources. Paramedics were hired, and the program criteria, referral process, and education plan were implemented. This program appropriately addresses their target group's healthcare needs in the comfort of their home, while increasing their satisfaction and overall well-being. Early results have indicated a 58% decrease in 911 calls for the patients on the Community Paramedic Program, a 45% reduction in ED visits by those active in the program, and a 65% reduction in ED visits for those patients who have already been discharged from the program. More than 50 patients have been part of the program since it went live in August 2017. Sharing early outcomes with community partners and through the media has increased awareness. With such positive results, the Erie St. Clair LHIN has been approached to ensure ongoing funding for this program. The box picker, affectionately named Picasso, is an automated storage retrieval unit with a robotic arm, and it stores over 1,100 drugs. It provides data to determine appropriate inventory levels, reducing stock on hand, expirations and buyer's time, and providing significant cost savings. This robot has allowed pharmacy to focus on other patient safety areas, such as medication reconciliation. The box picker implementation required barcoding of all the drugs in inventory prior to the go-live date of January 2017. Barcoding allows for verification when loading drugs into the automated dispensing cabinets and when filling medication carts and sending medication doses to the nursing units. The implementation team worked cohesively together with a clear understanding of each team member's responsibility. A dedicated team member was available daily throughout barcoding and box picker implementation. Pharmacy worked closely with facilities planning to ensure the best possible workflow layout in a tight space and proper installation. The team also worked closely with the Transform IT team to complete thorough end-to-end testing for a seamless operation. Pharmacy technicians underwent extensive testing, training, and certification for the new automation. Each contributed to achieving the team's outcome, knowing that this project would help Emily in the end.